This presentation is designed to help you know what to expect when you enter clinical courses. Welcome to the clinical portion of your nursing education. Students who have a plan to manage responsibilities and sequester serious study time have made good preparation for success. You are learning the necessary skills for one of the most highly regarded careers in the world. Nursing is embodied in Dr. King's quote, "Every day presents an opportunity to make a difference in someone's life." In this segment of the presentation, we'll discuss the varying times of day classes are offered. Depending on the semester you enter, you have different options for class times. The great risk of overcommitting while in clinical classes, whether it's from working, family responsibilities, or taking other classes simultaneously. What it means to be a nurse. What a nursing student can expect for time commitments, clinical preparation and clinical locations, and what nursing instructors expect of students. Nursing instructors say that if a student is passionate about nursing, no job is more rewarding. You will begin to learn the truth of this quote as soon as you have your first lecture and your first patient assignment. Learning and successfully completing nursing will be unlike anything you've done before. It requires a special set of skills in many areas, including critical thinking. When students pay attention to these skills, evidence shows they are more successful. Due to recent budget cuts, we are no longer guaranteeing fall and spring admissions. We will announce any change with as much notice as possible if we should have to make that revision to our program. So far, this hasn't been necessary. When a student begins nursing clinical courses in January, spring semester, they will have the choice of attending later in the day. But, for example, surgery, children's clinics, OB clinics are available only during the morning. So students must expect to have flexibility. Students enrolled in the generic ADN program have 4 semesters, approximately 24 months, of clinical coursework to successfully complete in order to graduate from the program and apply for the NCLEX exam. The clinical courses are sequential and cannot be compressed into any shorter period of time. When a student begins nursing clinical courses in August or fall semester, they'll have the choice of attending early in the day. Many clinical sites are available to students only during the day, so your scheduled clinical hours should cover time-sensitive areas like surgery, children's clinics, and OB clinics. A student will hear this term, the nursing process, mentioned in every nursing course until graduation. It involves critical thinking, assessment, nursing diagnosis, planning, implementation, and evaluation of nursing care. Each sequential course builds on the knowledge, skills, and critical thinking a student is gaining, becoming more complex and involved with each semester. Learning will be different. Memorizing is what you've done all your lives to pass tests. Like, what is your blood pressure? Understanding is knowing how the facts you learn work together, like, what does 120 over 80 mean, and is that okay? Application, which is a higher level thinking skill, is using the understanding to solve a problem. Like, should I give the blood pressure medication? How and when? Nursing school is very demanding. Students have a hard time believing this slide until they actually enter nursing courses. Then, sometimes it's too late. A student who doesn't have enough time to really study will spend the rest of the semester playing catch-up for a failing grade. It takes at least 3 hours of study for each credit hour of class. The students we see at most risk of failing a class are the ones who add too much to their nursing school schedule. Sometimes students try to retain a full-time job. Some try to combine nursing with other courses. While we include this information for your benefit, if you know ahead of time that you're putting yourself at risk, then you can plan for management of your time and family responsibilities. Other ways your time is used could be in online modules. They may need to be completed with pre- and post-testing to learn skills. Study habits may need to be altered to fit new content. The reading is more difficult with unfamiliar terms and content. Some relearning of areas like math may be needed for medication and math calculations. Opportunities for unique learning may be made available outside of normal class or lab hours. Students may be required to go to the clinical facility the night before the clinical visit to receive their patient assignment. Students should expect to spend time in preparation for instructor discussion and questioning for patient charting, familiarity with pathophysiology and treatment, and a plan for nursing care for the clinical day. These represent sample clinical skills taught in your first semester. These skills will be taught in the lab or classroom prior to going to the clinical site. Students usually need additional time in lab practice to feel comfortable with these skills. Students have found it helpful to review skills checkoffs in the text and video presentations on the nursing lab computers. You'll also be taking psychiatric and mental health nursing. Typically in the Med-Surg classes, once students receive their patient assignment, they will study various conditions, drugs, and procedures. Your clinical instructor will ask about your knowledge of the condition of your patient or patients to make sure you've prepared for this interaction. Students are responsible for being familiar with patient care, medications, and treatments. Pharmacology will be taught over the entire semester. This is a typical schedule for family-centered nursing, or OB and PEDS. You will study acute and chronic illnesses and health maintenance for patients in childbearing years and all stages of childhood and adolescence. Normal aspects of care and growth and development are also covered in this course. A variety of community sites are chosen to provide the student with an opportunity to incorporate theories of human development, growth, birthing, behavior, teaching and learning, and family constellations into client care delivery while utilizing the nursing process. This is the schedule you can expect in your last semester. Advanced Nursing Concepts expands the application of the nursing process, critical thinking, planning, implementation, and evaluation of nursing care in the care of persons throughout the lifespan who are experiencing trauma, burns, respiratory failure, and chronic neurological conditions. Also, the student is provided the knowledge to lead and manage the healthcare team, utilizing appropriate delegation and evidence-based nursing. Students work the same schedule as their assigned clinical preceptor. You will be taking Nursing 230 physical assessment in the same semester. You're entering one of the most respected and trusted professions. We expect you to conduct yourself as a professional, arriving on time, being prepared, making a sincere effort, and taking responsibility for your actions and your own learning. That means arriving on time even if you had trouble sleeping the night before, being prepared by pre-reading content before class, and making a sincere effort by participating in class to understand and clarify. A student who is self-disciplined stays on task as needed and manages time to focus on priorities. A student who's sensitive to diversity expresses appreciation of human differences related to values, culture, and personality. A student who is reflective and self-corrective carefully considers meaning of data and interpersonal interactions, asks for feedback, corrects own thinking, and is alert to potential errors by self and others and finds ways to avoid future mistakes. A student who is courageous stands up for beliefs, advocates for others, and doesn't hide from challenges. A student who is flexible changes approaches as needed to get the best results. A student who is empathetic listens well and shows ability to imagine others' feelings and difficulties. Student preparation helps make the sacrifices easier to manage for students and their families. The rewards are great. This is what one student said about time and study commitments. You'll study about 6 hours every day, including weekends. Just before a test, it may be more than 6. My family support system has helped me survive. My husband cooks. My parents help with my kids. I couldn't have done it if I'd tried to work, take care of my family, survive nursing school, and take general education classes. I think it would be impossible. One reason nursing is so time-consuming that it's a new way to learn. You don't memorize. You take everything you've learned and you make it functional in nursing care. Thank you.